husband. Like you can clip off the front of that. Clip off that.
Okay. Hi, my name's Kristen, and I'm here today to perform an Heent assessment on our patient, Michael here. And I would start by, of course, gathering my equipment, providing privacy, performing hand hygiene, and then as I come in, I would, of course, try to observe the appearance of my patient. I'd look at his hygiene and try to notice any possible abnormalities like facial inconsistencies as I come in the room, and I don't notice any. He has appropriate hygiene. I notice his skin is appropriate for ethnicity and his face is symmetrical bilaterally. His clothing are appropriate, and he is awake, alert, and oriented ×4. He has demonstrated that he has appropriate speech, and he doesn't hesitate to make eye contact. So then I would start my assessment by looking at his scalp and hair. So I would touch his hair and scalp and make sure that I don't feel any lumps or bumps or anything abnormal. I notice that the pattern of his hair is appropriate and consistent. I don't see any patches or anything that looks abnormal. Again, we'd observe facial symmetry. I would feel along his temples for his temporal artery, and then I'd feel his temporal mandibular joint, and then I would also feel for his TMJ, and I'd have him open his mouth and close it. Okay. And then I would go on to test his eyes, and in doing that I would use an ophthalmoscope for our first though I would use my pen light, and I would observe that he has perla intact. So first I would shine a light into his right eye and look at his right pupil, and second I would do his right eye looking in his left eye to make sure that he has equal and concentric accommodation, and he does. I'll have you look straight at my pen, and then behind me, and then back at the pen, and then behind me, and his pupils do dilate and constrict as we would expect them to. I'd look at his corneas. You notice he has a bit of redness in his eyes, but I don't notice any yellow or signs of jaundice, anything abnormal. I pull his lower lids down to check his conjunctiva, and it's appropriate in color. His pupils are the right size. I don't notice any problem structurally. And then another test we could do for his eyes would be the Snellen chart, which would be have him read from 20 feet away the eye chart to from the biggest letter to the smallest letter that he could see. Then I would also test his peripheral vision, and I do this by asking him to tell me when he could see it.
No.
Okay. And then I'd go from up high.
No.
Okay. And then I'd have him also, I would check his fields of vision, and I would have him follow my pen, his eyes, and back, and then up and down. And then I'd try from the sides and have him follow, and then up high, and then lower, and then back up high. Okay. Then I'd go on to inspecting his ears, I would first do a visual inspection, and I would check the cartilage. I don't see any piercings or damage, anything that looks like it's an abnormality. I notice that there's no external drainage I can see here. And so then I would use my otoscope, and I would kind of steady myself on his shoulder. I would visualize the tympanic membrane, and then also that there's no excess drainage, and it looks good. And then I would repeat on the other side. Okay, and then I would do the whisper test, which would include me saying a common phrase to him and then having him repeat it. So if you could cover your right ear.
Apple.
Okay. And this one. Okay, okay, that. And then we could also use our tuning fork and test, and we do that by, we would hit it so that it vibrated, and we would do it here, and we'd tell him, ask him which ear he could hear it in. Okay. The answer both is appropriate. We'd want him to hear it equally in each ear, and then we would hit the tuning fork and we'd put it against the bone and have him notify us when he stops hearing it.
No.
Okay, and then we would put it to the side and ask him to tell us when he can't hear the air conduction any longer.
No.
Okay, and then we would repeat this on the other side.
No. No.
Okay. So everything with his hearing seems appropriate, and we would go on to look at his nostrils. Okay, could I have you tip your head back slightly? And then I would be looking for the color of his mucous membranes, checking for a potential deviated septum, also checking for any drainage that might be abnormal in his case. He doesn't have any excess drainage, and appears no deviated septum as well. And so then we would go on to his mouth, and we would look at each aspect of his mouth. So we would look at like the inside of his cheeks, his tongue, his teeth. We'd also look at his uvula, tonsils, and we would also be noticing if there was any signs or symptoms of infection, such as strep or thrush. So if I can have you open your mouth and say ah. Okay. And I don't see any problems with his teeth. He has good dentition. Could I have you lift your tongue? Okay, and then stick your tongue out. Okay. Everything seems appropriate. And the mucous membranes are moist and red, but not overly red where we suspect infection. So then we could also test his gag reflex with a tongue depressor, and then we would go on to look at his neck. We'd be inspecting the lymph nodes, and we would start up by his ears, and then we'd go all the way down his jaw, underneath. We would do along his clavicle. We would check the back of his neck as well, and we would be looking for size and consistency, a swollen lymph node could indicate infection or disease process, cancer, things like that. We would expect a lymph node to be small and pea-sized and easily able to be manipulated or moved. Then we would go on to inspect the thyroid. So we would feel the bottom of the thymus, he swallows, and then we would feel for the thyroid gland, making sure that it wasn't swollen or tender. We would look for goiter, and then we would want to make sure it also was pliable and able to easily be moved. We would, throughout this, we have checked a bit of his range of motion in his neck. However, we'd go ahead and ask him to look to either side, assess his muscle strength, and of course the range of motion. And then we could feel for the carotid pulse. And then this would conclude our HEENT exam. Thank you for your time.